What type of tests are performed to determine eligibility for transplant?
So patients undergo vital organ testing prior to transplant to determine how safe that procedure can be for them. And that vital organ testing includes bone marrow biopsy first to make sure disease is in good remission. That helps actually determining what would be the risk of recurrence after transplantation. We also perform testing such as heart echocardiogram, lung function tests, computer tomography of the chest to make sure they don't have pneumonia, laboratory testing for kidney function as well as liver function assessment, and multiple very extensive infectious workup that also includes HIV testing and hepatitis testing. And with all this assessment in place, we can best determine who can be better candidate for transplant in terms of not having major complications that can result into mortality after transplant procedure.
Does frailty or fitness status affect transplant eligibility?
Actually, that in multiple studies has been determined to be important in terms of complications that can happen after transplant, in terms of morbidity as well as mortality risk. And we generally use that in patients who are 65 and older undergoing allogeneic transplantation. As I mentioned, like patients up to age 75 are generally considered for transplant. We also perform transplant in patients who are not frail and are relatively healthy and can be older than 75 up to age 80. So therefore, age alone is not a factor for us to exclude someone from transplant procedure. But that frailty assessment is consistently being done in geriatric population and also in patients wherever we have doubts that they are not fit enough for transplant procedure.